Hundreds of thousands of women suffer from what the Duchess of Cambridge is hospitalized for, and while many are calling it morning sickness, it's much more serious than that. For some women, even drinking water during the 9 months of pregnancy is impossible. The heir to the British throne, Prince William, was back at the hospital today in London, worrying over another heir, his future baby, and his very ill wife, the Duchess of Cambridge. 18 months after they were married, the couple are expecting their first child, but things did not go quite as planned. Kate is very early in her pregnancy, but because she's feeling so sick and will be spending days in the hospital, the couple felt they had to tell the world. It is called hyperemesis gravidarum, and it is much worse than simple morning sickness.
This is intractable throwing up, non-stop. You can't hold any fluids or food down, and in some cases, like we're seeing here, hospitalization is required.
The news has set off a frenzy, consuming not just the British media, but the world's.
Prince William y Kate Middleton.
The speculation now turns to the baby's sex and name.
At the moment, we think it's going to be a girl, and if it is going to be a girl, Elizabeth is the 8-1 favourite, and who better to name the baby after than William's grandmother, aka Her Majesty the Queen.
Here's something very interesting. The British Parliament is moving quickly to scrap a centuries-old law that has put male heirs ahead of their older sisters for the first time. Whether the baby is a boy or girl, he or she will be the future king or queen. But we want to talk more now on Kate's sickness. Dr. Laura GRUSKIN is an OBGYN with Beaumont Hospital, and she's here now to explain what Kate is suffering from and why she's been hospitalized. So many people think this is just morning sickness, but this is much more dangerous than that, right?
About 80% of women can have morning sickness, but when it's going on and on intractably, you've lost 5% of your weight, you may have electrolyte imbalances. We call that hyperemesis gravidarum. It affects 1 in 200 pregnancies, and it is a serious but rare complication.
Now, she's hospitalized right now. Will she come out of the hospital, or will she be hospitalized for the full 9 months, or in and out?
Most often, with giving her proper fluids and anti-nausea medications in time, they will gradually reintroduce solids to her diet, and if she can keep things down, then usually she'll be able to be discharged to home, sometimes on some oral medications, and usually she'll do well. About 15% of the time it continues, and you may be repeat hospitalized after discharge.
Is there a risk to the baby?
Most often it's a self-limited condition, and the babies do well. If you can clear the ketones with the IV fluids and get her condition under control, then most often the babies are going to do very well. Now,
I did hear some people talk about maybe she's carrying twins or possibly a girl when you have a condition like that. Is that true?
In terms of it being a girl, I'm not so sure about speculating on that. In terms of multiple gestation, such as twins, with a higher amount of hormones in placenta, it makes the condition more common. So that's one of the possible reasons why someone might be at risk for hyperemesis.
Is that right?
Yeah.
So, I mean, is there a way to know going into your pregnancy? Is there family history? Any way to tell that you might suffer from something like this?
If you've had it in a prior pregnancy, obviously it's a clue that you might have it again. If you've had reactions to hormones in the past, such as the birth control pill with some nausea, that might be a risk factor. Older or younger moms might be more at risk. Sometimes thinner patients or patients with underlying GI issues are more at risk.
All right, Dr. GRUSKIN, thank you so much for coming in and giving us all of your expertise on this. So many people talking about it.